Welcome to the Anatomy of the Ankle and Tib-Fib recorded lecture. This lecture will discuss anatomy of the ankle joint and anatomy of the distal and proximal tibia and fibula. So let's start our discussion by looking at the ankle joint. The ankle joint, remember, is formed by three different bones. So you have the tibia and the fibula of the lower leg, and then you have one tarsal bone, the talus. So if we look at our AP projection here, here's your tibia, it is medial. Here is your fibula, it is lateral. And then of course, here's your talus. So if you were to tell me which ankle this is, right or left, you would say this is a right ankle. Okay, so tibia, medial, fibula, lateral. Okay, let's start with the fibula. Notice this distal end here. The fibula is very slender, and as it progresses distally, it kind of widens into this extended, widened area next to the talus. This is actually a bump that you can palpate on yourself. It's called the lateral malleolus. If we look at the tibia, you see the tibia also has a malleolus. That is your medial malleolus. And again, you can palpate both of those bumps on yourself and on your patients. Notice the distal end of the tibia. It's a very broad surface. If you were to tip the lower leg up on end and look from the bottom up, you would see this flattened surface here, and that is called your tibial plafond. The tibial plafond articulates with the broad surface of the talus. Now, the inferior portions of the tib and fib form this deep socket or three-sided opening called a mortise joint. And into this three-sided joint is the talus, just kind of slips in there and fits nicely. The entire three-part joint space of the ankle mortise isn't seen on a true AP projection, however, because notice the distal fibula is overlapped by the distal tibia and part of the talus. This overlapping is caused by the position of the distal fib. You can see here it actually sits posterior to the distal tibia. And because it sits posterior, again, it's slightly overlapped by these structures. If you wanted to visualize the entire mortise joint open, you would have to roll the leg 15 degrees internally into an oblique projection. And we call that the mortise position, and certainly we'll take a look at that closer in lab. The anterior tubercle, so notice that here, that is an expanded bump or process at the distal anterior lateral tibia. So let me say that again. So the anterior tubercle, it's distal on the tibia, it's anterior, and it's lateral. Okay, and again, it kind of overlaps part of that distal fibula and as well as the talus. The distal tibial joint surface. So here again, that forms the top or the roof of the mortise joint is called the tibial plafond. We already learned that. And certain types of fractures in children can involve that tibial plafond. Okay. Next, let's look at the ankle from the lateral position a little bit closer. Here you can see the ankle in a true lateral. And again, it demonstrates that the distal fibula is about 1 centimeter posterior to the distal tibia. And this relationship becomes really important when we're evaluating whether or not our ankle x-ray is a true lateral. A common positioning mistake that people make is to over-rotate the ankle so that the medial and lateral malleoli are directly superimposed. However, if you look at this x-ray on the right, you'll notice that a true lateral is indicated by the fibula covering the posterior half of the tibia. So in anatomic position, the malleoli shouldn't line up. The lateral malleoli should be more posterior than the medial malleoli. Also notice that the lateral malleolus extends about 1 centimeter more distal than the medial malleolus, and you can really appreciate that better on the AP position that we showed in the previous slide. but here you can see it kind of extends downward about 1 centimeter below the medial. Next, if we look at the ankle joint, again from the bottom up, you can see that this tibial plafond has a broad and slightly concave surface. And again, notice the lateral and medial malleoli. You can see here that the fibula, and this again, it comprises the lateral malleolus, sits more posterior than the medial malleolus. Now notice, if you were to draw a line between the two malleoli, this dotted line here, it is approximately 15 to 20 degrees from coronal plane here. And that line between the two malleoli is referred to as the intermalleolar plane. Now the lower leg must be rotated 15 to 20 degrees medially to bring the intermalleolar plane parallel to the coronal plane. And this relationship of the distal tib fib becomes really important again in positioning for that mortise projection that we talked about a second ago. So what we're seeing here is essentially an AP. We're looking at the bottom of the ankle upward, but this is AP or anatomic positioning. Again, the lateral sits more posterior than the medial. You will not see the three-sided mortise joint open in this AP position. So let's take a look at two radiographs to compare the difference between the AP and the mortise. So here on the left, you have an AP ankle. And remember, in a true AP, the distal fib sits about 15 to 20 degrees posterior of the tibia. And this causes the lateral joint space to appear closed. So here's our mortise joint, a three-sided joint. Notice the lateral aspect appears closed, while the superior and medial you can see through much easier. Notice on the right, this image, the patient's leg has been rotated 15 to 20 degrees medially, which places the intermalleolar line parallel to the image receptor. And now look at our lateral mortise joint appears open. So that is the difference between the AP and the mortise. Okay. So here are some x-rays. Let's practice and see if we can identify this anatomy that we just learned. So let's start with the image on the left. This is an example of a mortise. So A is your fibula, B is your lateral malleolus, C refers to the open mortise joint, D is the talus, E is the medial malleolus, and F is an epiphyseal plate. And notice it's starting to fuse here, but it's still open a little bit here. Okay. Let's look at the x-ray on the right. This is your lateral ankle. So A is fibula, B is calcaneus, C is cuboid, D is the tuberosity, remember on the fifth metatarsal, E is navicular, F is talus, G is that sinus tarsi, remember where ligaments pass, H is the anterior tubercle on the distal tibia, and I refers to the tibia. Okay, good. So we are going to pause part 1 here. We will pick up with proximal tib fib anatomy in part 2.